This video is going to instruct you in the proper technique and location for intramuscular and intravenous injections. We're going to start with the intramuscular neck injection, and we want to go over first some structures that you need to stay away from that will cause swelling, pain, and or complications with most intramuscular medications. The first is you want to stay away from the spine. The spinal column runs low in the neck from the pole down to the shoulder. Do not inject anywhere near that. The next is the nuchal ligament, and that is a broad ligament that runs from the withers to the pole, and you want to avoid that as it will not absorb medication. Where you want to stay in front of the shoulder and you can feel the spine of the scapula, and the best thing to do is feel that and then let your hand roll off the spine of the scapula into the meaty portion of the neck. And anywhere where your fingers are is a safe injection spot. If you'll notice, you are at least a hand's width above the spine, and you would be at least a hand's width below the nuchal ligament. So we're going to inject. You find your location, you lightly pinch the skin next to the location, insert your needle next to where you've pinched all the way into the hub, and then you draw that back several times. Assure yourself you do not get any blood, and then you inject fully. Then pull straight out, let go of your skin. This area is good for roughly 15 to 20 cc's per site. If you have more than that, split it up, redirect your needle, and or go to a different location. Again, you always want to draw back, make sure you do not get blood. If you get blood, pull your needle out, go to a different location. The next site that we consider safe is in the hindquarter. There are two muscles here, and there's a groove between them. Stay out of the groove. Your medication will not be absorbed there. Have some restraint, either the horse tied, lightly twitched, or somebody holding the head. And instead of pinching here, it's best to lightly slap that area, and then you can introduce your needle. That somewhat numbs and allows the horse to realize that you're back there. And then you draw back, inject fully. Now we're going to introduce the intravenous technique. The jugular vein runs in the jugular furrow. It's going to be present in all horses regardless of weight. A fatter horse will be a little more difficult to see. In the upper third of the neck, you want to occlude the jugular vein with your thumb and leave that there. A common novice technique is to put their thumb there, occlude the vein, and let it go multiple times. During the whole procedure, until you're in that vein, leave your thumb there. Now you'll take your other hand, lightly stroke the vein, and you can see that vein distended. That's where you're going to stick your needle at a roughly 25-degree angle, bevel to the skin. You draw blood, and now that you're ready to inject, you let your thumb go, you inject your medication. You redraw and inject again. When you're finished, pull out. If you have any bleeding, hold lightly at the site. Thank you.